Today I'm going to be discussing the condition of otitis externa. I will be discussing the pathophysiology involved, treatment measures, and the prevention and promotional practices involved. Otitis externa is also referred to as swimmer's ear. It's a diffuse inflammation of the external ear canal, and it can extend distally to the pinna and proximally to the tympanic membrane. Most often, the symptoms involved with otitis externa are pain, hearing loss, itching, discharge, redness, both externally and inside the canal, as well as edema, inflammation. There are many predisposing factors or conditions that will enhance the likelihood that this condition will develop. If an individual has especially hairy ear canals, or if they are prone to cerumen obstructions. Of course, swimming, humidity, sweating, anything where moisture can build up in the ear, and anything that would cause moisture to remain in the ear, such as with the use of a hearing aid or earplugs. The most common pathogens involved in causing this condition are typically bacterial in nature, both aerobic and anaerobic organisms, but there are also fungal agents that are known to have caused this condition as well. Typically, the development of this condition involves trauma or a breach in the skin integrity, or exposure to excessive heat and moisture within the ear canal. Once there's that breach in the skin integrity or the buildup of the moisture in the ear canal, that leads to skin inflammation and swelling. This leads to itching and obstruction to the adnexal structures, the cerumen glands, the sebaceous glands, hair follicles, okay? And with the pruritus also comes scratching. So that's where the breach in the skin integrity occurs. Once you have that change in the external auditory canal, that leads to a change in the quality and quantity of cerumen, increase in the pH of the ear canal, and dysfunctional epithelial migration. All of these conditions foster an environment for growth of pathogens, and then that's when the condition subsequently develops. Treatment measures that are often used include topical antimicrobial ear drops specifically. Side effects for those can be itching, pain, headaches, irritation, stinging, burning, redness, as well as topical corticosteroids. You can also use a Pope earwick. The Pope earwick can be pretty easy to install, and it removes and absorbs the moisture in the ear. Doctors can also prescribe pain control, anti-inflammatory medications, and of course, keeping the ear dry is another treatment method. Preventative measures are pretty simple. We recommend that these patients don't use cotton swabs, that they avoid the frequent washing of the inside of their ears, specifically with soap, which can clog up the ear canal. Avoiding swimming in polluted waters, specifically freshwater swimming. When someone does go swimming, make sure that they empty their ear canals of the water after swimming or bathing, and no earplugs while swimming. The incidence of this condition can have a huge impact on population health, both as far as visits and as well as monetary measures are concerned. According to the CDC in 2007, it was estimated that every 1 out of 123 persons was affected with otitis externa, and healthcare providers spent an average of 597,761 hours evaluating and treating otitis externa, at a cost of $200 per visit and an annual estimate of $489 million in direct healthcare payments related to this condition. We can see why it is imperative that prevention be a topic that we discuss with these patients to prevent costly healthcare measures in the future. Treatment measures for otitis externa can be difficult for a small child to understand. They really need a safe and calm environment that will reassure them before administration of eardrops. So there are always certain complications that can prohibit the safe delivery of medications. So I'm going to go over a few of those complications right now. Small children might demonstrate anger or some pushback or obstinacy in regard to eardrop administration. Small children can become easily distracted. They can be non-cooperative and evasive. Small children may display fear or may become concerned about the medication that you're going to administer. Children can become very anxious and very uncomfortable prior to the administration of medication. Patients can display aggression and become defensive when they are scared. You can avoid all of the complications seen in the previous videos by simply providing a safe and calm environment for children to receive their medications. Provide clear instructions in a language they will understand. And if they still display fear, for their safety, you can actually apply a papoose. This can be either done with a sheet, blanket, or towel, and that'll ensure their safety prior to installation of the eardrops. Sometimes with small children, it can be difficult to administer eardrops. One way that you can prevent them from moving around during the installation of the eardrops for their own safety and for your safety is to papoose them. Papoose them gently in a sheet or towel so that you can safely administer eardrops. And now I will properly demonstrate how to administer eardrops. Okay, today I'm going to be showing you how to instill eardrops. First and foremost, before you instill the eardrops, you want to make sure that you thoroughly wash your hands. After you properly wash your hands, if you're a healthcare worker, make sure you don gloves. If you are at home and you're instilling the eardrops into a friend or family member's ear, just make sure you thoroughly wash your hands beforehand. You never want to instill eardrops that are cold into somebody's ear. You can cause pain and dizziness. So you can warm up the medication. Basically, you can roll it in your hand a few times, or you can leave it sitting out at room temperature prior to installation. Prior to instilling the eardrops, when you open the vial, you want to make sure that you don't touch the tip of the medication bottle So open it without touching the tip so you're not introducing any bacteria into the medication. For an adult, you want to pull upward and back before you install the eardrops, and in a child under 3 years of age, you want to pull down and back before installing the eardrops. So this is an adult. I'm going to be pulling upward and back. I'm going to install however many eardrops are necessary per the doctor's order. After I install the eardrops, then I'm going to have the individual or the parent of the child, basically they can hold down this flap here in the front to keep the eardrops in. They need to stay in that position for about 3 to 5 minutes to make sure that all of the medication reaches the ear canal. After you're done, recap the medication without touching the tip again. Place it for proper storage. Wash your hands thoroughly. That's it. Thank you very much.